Hey everyone, welcome to another episode of the Next in Time podcast. I'm your host, ST Tangarala, and today our guest is none other than Abhishek Mohanty. He is the founder and CEO of Careflick, an AI-powered platform that is a fast, secure, easy-to-use app that provides personalized support to caregivers of people with special needs. And he is looking to make a major future impact in the world of healthcare. So, Abhi, welcome to the show.
Hey, thanks, SD. Thanks for having me.
Well, so I presume that everything that you're doing right now is like you're trying to make that major impact in the healthcare space, right?
Yeah. I have been in the healthcare space for the last 6 years, a little more than 6 years, and I'm trying to, make it more affordable, accessible, and efficient for specifically for people with special needs to start with, and
But,
their caregivers. Yeah.
like, were you someone with that needed special needs or something?
Yeah, I mean, so in my previous organization where I was working with, so I was closely working with people who had dementia, Parkinson's, right? And then personally, also, I know someone like a very close relative of mine who has two kids with autism, and I know like how difficult the journey it has been for them. So yeah, coming from both personal and professional experience, hence it led me to like let's try and build something, create a better world for, as you can say, like for people with special needs.
So how's
Yeah.
it been? I mean, I looked at I looked at what you've done, and you've started this
Yeah.
company earlier this year in September, right? So what was the catalyst, I would say, that you managed to that made you want to start this?
Well, I think the catalyst would be like, spread over the last 6 years as I got into the healthcare space. And like in my previous organization where I was working with, I realized how efficient caregiving needs to be able to make like, a significant difference in the people who are receiving care today. And as a society, it's getting more and more difficult because, you know, smaller families and uh, you know the ability of people to pay for efficient and professional care, and like having seen all of that very closely, interacting with family members, interacting with family members who are like prospective customers, and like family members in my own circle, I realized, it really needs that person-centered approach. Care needs to have that tailored approach, and and it needs to be affordable,
Yeah,
right?
because if you notice, here in the US, healthcare costs are just all through the roof. And
Yeah.
and the funny thing is you just can't get access to quality healthcare unless you're employed. And with
Yeah.
everything, especially with layoffs happening left and right, and if you see in across many industries, particularly the tech industry,
Yeah.
like more and more people are losing access to quality care.
Yeah.
And it's a very weird system here. Like like I presume in you like where you live in Germany, right, in
Yeah.
Berlin, I would say that you guys have very affordable access to healthcare in a way. Like it's government sponsored, right?
Right. Yeah,
So
that's actually like true in developing countries like in Germany. But like before moving to Germany, I was actually in India, where it's the healthcare system is not that evolved, right? So no, so I mean, there's like people are facing like issues, trying to manage, trying to get access to better healthcare, but all of that comes at a cost. And in countries like India and more developing countries, uh, if for someone to like avail professional and efficient caregiving, it boils down to breaking your bank, and it does not have to be that.
yeah, I mean, I
So
saw that. I mean, if you've noticed, like the recent COVID pandemic in India has been a very
yeah,
it has been very rough for a lot of people because
exactly, yeah.
yeah, because people not a lot of people have access to healthcare, and then the hospitals being overbooked, and if you I think I've saw the oxygen crisis even.
Yes. Yeah, I mean, as such, the medical fraternity, the healthcare fraternity, healthcare industry was so overwhelmed, and people were still struggling to get care for themselves and their family members in this whole COVID period. and it came down to, there used to be so much of campaigns going around where people used to like ask for the public to be able to raise funds to, just be able to save their loved one. And like campaigns like on Millap, there's a platform called Millap, and many other crowdfunding platforms where people are just asking, like, please help us raise this much money so that I'm able to save my family member, my daughter, my father, or my mother, or my wife. And I think COVID has really opened everyone's eyes, like how um, how weak the whole healthcare system is, how fragmented the whole healthcare system is.
Got it. And so now tell me, yeah, because now you're building this startup Careflick that is trying to make healthcare more efficient. So before we get into that, I just wanted to know more about who you are, who Abhi is, and where did you come from, and what made you, become who you are at the current moment.
Sure. So I was like born and raised in this state in India called Odisha, and I was like mostly like I had my formative years in this city called uh, Rourkela, which is like a township, and like I did my schooling there. Then I went to did my college from Dehradun, another city in India. And after that, I've mostly been entrepreneurial. So straight out of college, I went on to like co-found a design firm with a bunch of my friends from college. We did like couple of projects with companies like Maruti Suzuki and Human Society International and many more.
Is
And then
this
I went
this
on.
is Wolke Designs, right?
Yeah, this is Volky Designs. Yeah.
Okay.
So that was my first, and like my first foray into my professional journey. I started with something of my own, and after that, I started this D2C brand, which is in the Indian handloom and handicraft space. So this is Craft You Need, and the company was actually Swadesh Art Retail. The brand was Craft You Need, where we were, trying to work with a lot of artisans from all over India, and like try to create new modern day products using age old art forms, and like handicraft and handloom. And yeah, that was my second stint. And while I was working on these two like Volke Designs and Craft You Need, I I got introduced to Epoch Elder Care, which is where my journey in the healthcare industry started.
Really?
So yeah, and
You were
that
you were
was
mar you were a marketing person for Epoch Elder Care.
yeah. I actually used to wear multiple hats at Epoch. So, but yeah, my role was primarily in design and marketing. So, design being like design of the homes, how they are more elder friendly and dementia friendly.
Hmm.
And marketing, of course, all things marketing like online, offline, PR, and all of that.
And this is in Delhi, right?
Yeah, this is so they are Epoch is based out of Delhi, and they have homes all over India. Yeah.
Got it. And so now, like, what was the trigger that always gave you the fact that I want to be an entrepreneur, or I want to make something massive impact, make a massive impact in the world?
Um, I don't know. It was like I've always been like someone who was like always wanted to do something of their own, and I think the major trigger would be like I did my bachelor's in automotive design, right? Automotive design engineering, but I wanted to get into something that is core design. And for me, when I realized that my educational background does not match with what I want to do, so and I was not getting many offers from companies like if I want to do something design. So I just thought, let me just start off my own, and I'll learn things on the way. And that's the kind of person I've always been. Like
Yeah.
even if I don't know something, I'll just learn on the way and make it happen.
That's the number one thing everyone has to do is like, especially now in this world where are getting more and more scarce.
Yeah,
And
yeah.
it's important. I think there's someone that said that, I think it was the guy named Naval who said that there's going to be 8 billion monopolies around the world. Everyone will have their own unique skill set and talent that only they can dominate upon.
Absolutely. Yeah, yeah. I
So,
agree.
So it's kind of like that. I think everyone right now is going to be their own entrepreneur. They're going to make something of themselves and then, become what they are. So it's kind of like where, yeah, you just
Yeah,
woke
yeah.
up.
I think that's the I think that's one of the finest way to grow. Of course, like, you know, education and all of those are like very important factors when you have to grow in your professional journey. But having that inner drive within yourself, that I want to create something of my own, or I want to build my own identity. And today it's I think the millennials are most famous for that. Like, is the hustle mentality that makes you want to do try many things and learn as you go and try many things and build something of your own.
The funny thing is for me is that I have done I've worked in many different industries since I've finished, since I graduated college or since I've been in college. So I've used to, I mean, I worked in sales, I worked in real estate, I worked in tech, I worked in marketing, I worked in, and also I worked with, I mean, even with this podcast right now, it's kind of another thing when you
Yeah,
try a lot of different things, you get to know what your strengths and weaknesses are, and but with the strengths that you develop, then that's kind of how you can make your career more enriching, right?
exactly. Yeah, yeah.
Cool. And
I think
so,
that actually, I mean, I'll just tell you like this. This is some quality that my wife really imbibes in me. Like, she tells me, like, this we are both very entrepreneurial. I mean, she's always been this super support for me, where she tells me, like, if you want to do something, just go with it. Just get your hands dirty and just start with it, and you learn as you go.
and so
Yeah,
now you're trying to make. I think now you've been in design, now in healthcare. Now you're trying to venture into AI in a way, right? Like
yeah,
with
yeah,
what you're building right now, Careflick, you're on a mission to
yeah,
make the world a better place for people with special needs.
yeah.
And
And through a digital approach is
through it,
is key here. Yeah,
do you feel like you are combining what you've learned in design and tech and healthcare into building
exactly.
this
It's
program?
yeah. This is kind of like, all my last 8 years of journey kind of coming together and trying to build something that will actually truly make impact, not just from like helping people, but also being like, like super affordable, super accessible, and and hopefully super efficient, that it truly makes that impact.
Got it. And so what is about the vision that you're looking to build using AI? So tell me about the whole structure of what you're building with well, I forget the name of your company and but Careflick.
Yeah. So, like, what is the first interaction of technology? Like, what's the most simple interaction with technology of someone? It's like, flicking a switch,
Yeah.
right?
Or
So,
maybe just put something in and then you get an output, like in a way.
yes, exactly, right. So it's like that, like caregiving. Although it's such a very complicated journey, how can we make it more easy? And through technology is what I feel that we can make it like someone's like easier, like especially of the caregiver, so that he or she is able to impart better care for his or her loved one, right? Hence we came up with the name Careflick, like, let's make care as easy as flicking a switch.
Yeah, like care, like when you turn on the thing, you get a easy, affordable healthcare taken care of. All right, then you switch it
Exactly.
off, kind of thing.
Yeah.
So,
So,
oh, sorry,
you
keep
want
going.
to so the vision is basically like, the vision is the long term vision is to make this world a better place for people with special needs, and to demystify caregiving. Today caregiving is a thankless job. Like, it takes so much strain on you, and the rewards, you don't really see it. Of course, there's this reward that you see your person, your loved one, like, you're trying to give like a better deliver a better life for them. But it is a thankless job at the end. And let's demystify caregiving. And today, how many people, youngsters, would you see, like, what do you want to grow up? When you grow up, what do you want to be? And nobody would, like, everyone would say, I want to be like a pilot or like an engineer, you know a
Or I mean,
doctor.
here in the U.S., a lot of kids want to be YouTubers and TikTok stars.
Exactly, right. So let's make this caregiving a very respectable life skill is something that we want to, do through Careflick.
Yeah, because I've noticed that I think what you're trying to do is make health. I would say more like healthcare a skill more than a job, right?
Yes, exactly. It's a very essential life skill.
Yeah, just
And
alongside cooking, cleaning, and even driving, right?
yeah, yeah, exactly right. And there's this famous quote by Rosalind Carter, the former first lady of
Yeah.
US.
Oh, Rosalind Carter.
Uh,
Yeah.
yeah, yeah. She said there are four kinds of people. There are four types of people. One who are caregivers, one who are going to be caregivers, or one who are like receiving care, and who are going to receive care.
Right.
Right. So basically, like at some stage, at some point of your life, you are going to become a caregiver, right?
Yeah.
Or like even if you're a young kid or you're like an elderly person, or either you're taking care of your child or you're taking care of your mother or father, or your sibling. So at some stage, you will become a caregiver. And so how do we make this like a essential life skill for everyone? Like you are equipped for it no matter at what stage you're at. Right.
Right. Yeah. Because the funny thing is, I actually met the like Jimmy Carter and his wife like many years ago, like at a church. but that's just a fun fact about me. But anyway, so I was
Oh,
just gonna,
nice.
yeah. It was a fun opportunity. I mean, I don't think it'll be ever. I don't think it'll ever happen again, considering that with social distancing at times.
Yeah.
But anyway, so it's kind of I really like the way you phrased that with how Rosalind Carter was a major inspiration for you with caregiving.
Yeah.
And so what you're trying to do is make caregiving like like I said, it's caregiving healthcare like a skill, and you're trying to make sure that you don't like not everyone has to be a doctor, right?
Yeah.
But
Yeah.
but you just have to be someone who you want to use like well, with what you're providing, you can just basically give care to that person.
Yeah. Yeah. Exactly. Yeah.
So what is it like? What does the product look like in a way, like in terms of like
So
Careflick?
it's going to be a very super easy to use app, like something that you just open, you register yourself, you enter your details, like what kind of a caregiver you are. Like, are you a family member? Are you a volunteer? Are you like are you an informal family member, caregiver, like a house help? Or are you a professional caregiver, like a care attendant or a nurse? And then you enter details about the person that you're taking care of, and that's it. Like from a user point of view, that's it. Now you are into the Careflick world, where in the dashboard you will have access to what therapies to do, what activities to do, when to do them, how to do them, how often to do them. You'll get notifications about this therapy is due tomorrow, this activity is due tomorrow. So basically we'll create like a personalized care plan for the person.
Right.
Right. So one is that aspect. Whenever you solve for you, like what therapies, what activities, your personalized care plan. The second is we also try to educate the people, the caregivers, like educate them about the condition that you're trying to manage, and also about their personal situations. Like yesterday, since we are collecting so much data about the person, the caregiver, and the patient. So if they are going through any emotional strain or caregiving burnout, so we'll be able to tell them, why don't you you know go through these content. So it will be like, imagine a Netflix of content, like
Yeah, just like
podcast videos, and which is like specifically catered for you.
yeah. So why do you feel like this is not really available at the current moment?
Oh, it is. I mean, today you can Google anything,
Yeah.
right? But the thing is that you will be overwhelmed by the content that is available.
Yeah, you
Right.
have you have many different ways on how to prevent a heart attack, let's say.
Right.
I think the one thing I've realized is that, there's people have like in today's world, people are suffering from more lifestyle diseases. there's
Yeah.
going to be those moments where they have to be sent to the emergency room. And let's say if the hospital is 10, let's say 100 miles away and you
Right.
can't do anything about it. Do you feel like this is what's the way to, let's say, whatever information that I provide, that Careflick provides can be essential to mitigate the worst of what's worst of it?
It won't be like, it won't replace emergency or, professional healthcare services. It will just prepare you better on how to manage, the situations you are encountering and you may encounter tomorrow, right?
Yeah. Yeah.
So that you don't panic, you don't, okay, this is what this example, there's a person who is taking care of someone with dementia,
Yeah.
and the person is agitated. They can just go on the app and they just say, they will already have the details entered about themselves and the patient, and they just say that, this person is agitated, what do I do? And the app will immediately suggest, what therapy to do right there
Yeah.
and
Because I
right now.
think I feel like maybe in the future of healthcare is going to be more about like if it's just general problems,
Yeah,
you don't need to see a doctor. But if it's
yeah,
highly emergency, you got to get things done. Kind of, it's like it's very crucial that this therapy is provided. Otherwise, they're going to go. Yeah, it's going to go. I think that's kind of what you're trying to foster,
yeah,
right?
yeah,
That
yeah.
kind of environment where okay, the 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 average person can provide the basic care to the per to their
Exactly,
to
exactly.
whoever they need, rather
Yeah.
than yeah. Okay.
So basically, the average person has little or no medical training, right? So this app is going to be like a tool for you so that you're able to navigate your caregiving journey, like understand what to do, when to do, how to do them, and have like a have at least like manage your stress, manage the care better.
And so, how many people are currently? I mean, right now you've already built like an MVP or at least built some sort of
We
a
are
prototype.
currently we are currently building the MVP. So the unique part is that we also have we have built our algorithm, the
Yeah,
Careflick algorithm, which is going to understand the person and the patient and create like social and psychological profile, and basis that suggest therapies and suggest content. And even also there's one aspect where we'll also suggest which person to connect with. It can be another caregiver, or it can be a specialist you should speak with. So all of this, so this algorithm is something that we have created. We are training the algorithm, and we are going to file for a patent for this algorithm.
so are you gonna follow it in Germany?
In US, the company is registered in US. So yeah, we are
Yeah,
going to file for a patent in the US. And the app is now, like 30-40% built. And is January is when we plan to build the app, like the MVP is going to be built. February is when we are going to do a lot of testing, because there's going to be a lot of medical data on this. So it
yeah.
has to be HIPAA compliant and GDPR compliant, and it has to be super secure. And March is when we go to market for
March.
dementia and autism. Yeah.
Got it. Got it. And so, what do you see in terms of in foster? Sorry, what do you see in terms of challenges in fostering this vision?
So, one is there, like, in countries like India, there's lack of awareness, right? There's like lack of awareness regarding dementia. There these special needs cases. Like, for example, if someone has dementia in India, people would dismiss it as, oh, this is just age related
Hmm,
forgetfulness,
hmm.
right? So, one is awareness. And the second is, to build this app, we need to connect with so many experts and clinical specialists from all over the world, because these conditions vary from geographically and culturally, right? Like how it is treated in Europe is different from how it is treated in in India. Like the family system is
Yeah,
different in different countries, right? So we need experts so that who can give us this perspective to train the AI,
yeah,
like how it should make suggestions for someone who is in Germany, or someone who is in India, and someone who is in US.
yeah.
So yeah,
I mean, there's also 189 more countries out there besides
exactly,
the three that
exactly.
you mentioned.
Yeah,
I mean, do you feel like this is you're trying to build this global brand of I don't say the brand, but just a global like vision
yeah,
of making sure, like, regardless of which country you're in, like you're trying to train the average person on proper caregiving on very like basic aspects, and then
Exactly.
if they're facing an emergency, then they can just point out to the nearest hospital, the nearest specialist who could provide that.
Even if it is not the nearest specialist, I mean, the idea is also to connect them from a specialist from, from the opposite side of the world. Like today you are in India and you are unable to find like an autism specialist near you. You can connect with an autism specialist in the US or Australia or, UK, anywhere. So like, yeah, basically breaking borders when it comes to
But
providing
like,
healthcare.
do you feel maybe there are people? Do you feel that there is a issue where people are just saying, okay, you know what, I just will get help. Healthcare is right next door to me, and people are just going to be like, okay, I just want to be around the people around me in a way. Like, what do you feel that could be a challenge in terms of, let's say, global kind of like global health, like global service provider or something like that? Sorry, I think my question's a little too vague,
Yeah.
but
Uh, So I do understand your point. I mean, but healthcare, it's many of these cases actually you find that there is not a good specialist near you. Like, so what do you do then? So, like,
I
for
think
example,
I think the way I was saying is because let's say they have trusted doctors, like people have
right,
trusted
right,
doctors who will care for them.
yeah,
They will only subscribe to those people, and let's say let's say they trust them so much that they don't really trust other people around in
right.
another part of the world to give them that adequate care.
Of course, of course. I mean, yeah, I mean, see, healthcare, of course, works in this way that it's more word of mouth and on a referral thing. Like you will go to a doctor because someone else has referred that doctor to you. Okay, I
Yeah,
went to this doctor is good, so why don't you go and see that doctor? So because currently the communities are very localized,
yeah,
right? So we are also building this social platform where you can connect with anyone. So let's globalize these communities, right? So you
right.
are today you're taking care of someone who has a particular kind of dementia. Let's connect you with someone who's also taking care of a person who has that similar type of dementia, but not in your country, maybe in another country. Understand from his or her journey, so that you're able to like, okay, this is something that has worked for him or her in that country. Let me also try that here.
Got it.
So, right. So basically, like, let's globalize communities. Like these communities need not be localized and uh, running on just these specific parameters and thought processes.
Got it. Sounds good. Okay. So yeah, since we're running low on time, let me ask you this one question.
Sure.
What in terms, you've been in the startup space, you're an entrepreneur for many years. Like it's not an easy journey for a lot of people. So what advice would
Oh,
you give to these other people in terms of, who are trying to strike out on their own, or let's say they're trying to do something grand?
I think like validate the problem that you're trying to solve. Like identify a very 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 definitive problem that you're trying to solve and build and talk to people. Like talk to a lot of people around these problems that you have identified that you want to solve, and have patience. Patience is key, right? So not every day is going to be like, okay, this everything is going well in what I'm trying to build. You're going to have your ups and downs. So just focus on the long term vision, have patience, and just take one day at a time, and and just make progress versus the previous day
It sounds good.
is my key thing. Like, yeah, I
Yes, sir,
mean,
sir.
treat every day as a battle. Just solve it for the day and move to the next day and do it better than the previous day.
All right, cool, Abhishek. Thank you so much for coming on the Next in Time podcast, and let's see how
Thank you so much, Asti. Yeah,
let's see how your vision can be implemented and see how it'll make a massive impact in the world in the coming years.
yeah, yeah, yeah. Thank you so much. Yeah.